Hi there, viewers. Welcome to Dr. David's Reproductive Health Talk. Dr. Ayem David is a PhD holder in public health and a reproductive health expert. Today, our focus is on family planning. Doctor, you're welcome.
Thank you. It's a pleasure.
What is family planning?
Family planning is a complex word that refers to what it says planning a family. We are going to be breaking it into simple terms. Everyone on earth needs to plan to have a family. A family is a union of a father, a mother, and children. This is what we refer to as a unit family. It is only in our setting, like in Africa, where we now have extended family that you can go to aunties, uncles, grandfathers, grandmothers. But a family has to do with a man, a woman, and then their children. If we say family planning, this is knowledge acquired on how to make a satisfactory family, a happy family. Every individual growing on earth will wish to have a better family someday. I want to remind even our viewers that no one growing wishes to have a family of thieves. No one wishes to have a family of prostitutes or family of embezzlers, of a kind of wayward rascals. Everyone growing wishes to have a family that is a happy one, a loving family, a satisfactory family. If you ask even a woman who never went to school, or a father, a man who never went to school, he would tell you that he wishes his children to be doctors, to be lawyers, to be presidents, to be governors. They give you very, to be engineers, to be businessmen that have a lot of money. But it takes some knowledge to acquire that you will use to build the type of family that you wish to have. That is why it is titled family planning. I want to use this to cancel the myth that a lot of people think that family planning is a way of limiting women from having children or limiting the number of children or a way of spacing children. That is an aspect of family planning. I will want our listeners to understand that family planning is far broader than just that. Now, there are components of family planning. There are aspects. You either refer to them as components or aspects. For example, when you enter a village, there are big, huge quarters that make up a village. And a big quarter has a quarter head who is like a sub-chief there. If you put those quarters together like 8, 10, they can make a whole village. So family planning is like a whole village that has quarters. What are these quarters? The large quarters. This is what we refer to as components of family planning. This is what we refer to as aspects of family planning. It is going to be very good for our listeners to take note of this area so that we can already begin to cancel the misunderstanding, the misconception that people have about family planning. It will surprise you that some people don't even want to hear about the word family planning because they feel that it limits or it stops their women from having children. But I will shock you and even our listeners.
All right, you talk about components of family planning. What are some of these components of family planning?
Thank you. The very first one, sexual and reproductive health education. The education that everyone needs to know first the reproductive system of man. That is the male and the female. Understand how the reproductive system functions. You will hear the women, when they give birth to their babies, even in the labor room in the hospital, one of the first things the midwife does is carry the baby up for the mother to identify the sex, to say whether it's a boy or a girl. You see, even at birth, they start already differentiating the sex, and that's how they bring up these children to know that they are boys, to know that they are girls. As they are growing, they know that there are two types of people, the female and the male. That is already sexual and reproductive health. When you start teaching sex education, which you need to teach in schools, you need to teach in your home, you need to teach in your church, you need to teach in every community as The adolescents are growing. They have to have knowledge of the reproductive system and how it functions. That is why at one time a girl reaches puberty and a boy reaches puberty. And there are secondary sexual characteristics that will appear, like breast will grow on the lady, hair will grow on the pubic area, and even on the armpit. Soon she starts having menses. And this menstruation is one thing that people need to study well to understand the role of menstruation in reproductive health. And then even the women and the men need to know it. Anything that you need to understand concerning reproductive health, which falls under sexual and reproductive health education, is just one of the aspects. Number two, pre-marital counseling. Do you know that before you think of getting married, you have to go to the family planning unit so that they can teach you and whoever you think is your prospective partner? Because there's a lot of education to educate them. There's a lot of examination to examine them, to be able to find out if they are compatible enough to marry. Can they live together? Can they love themselves together? Yes, biologically, are they compatible? They get even to their genotype to understand if they can produce healthy children. Is there a possibility that they can produce children that are not very healthy? If that is the case, then we'll show it to them before they make the decision to go ahead to marry, so that we will not be having cases like sickle cell. We will not even be having cases like Down syndrome, cases like you see some families deliver children that may their senses are not very clear. Know that they are like Mongolians. They would refer in the quarters as fools or what, and some families are like stigmatized that family are fools. No, if they actually went for pre-marital counseling, it would have been corrected because they will find all of this for them. Then the number three is pre-conceptual counseling. That is still an aspect of family planning. Pre-conceptual means before pregnancy. Anytime a woman wishes to get pregnant, is supposed to plan for the pregnancy. And it's supposed to come to the family planning so that you teach you what it takes to get a pregnancy. It will interest you to know that some people are living in sexual relationship or even in marriage, and they go for years, and pregnancy does not come, but they're having sex every day. Sometimes somebody will even tell me that, doctor, we have decided to be having sex every day. That is worse, because you lack the knowledge of studying the menstrual cycle of the woman and then targeting sexual intercourse only during the fertile period. Then you have the baby. And even during the fertile period, you will do you plan the sexual affair so that you do business sex, business of pregnancy. You will not just be having sex, because there are two types when it comes to reproduction. There's pleasure sex and there is business sex. When you think you are looking for pregnancy, we will teach you at the level of the family planning unit, you and your partner, how to target. And it doesn't take 2 times of sexual intercourse to get a pregnancy. It's just once. But we'll teach you how to target it once. Then you can travel. The woman will get pregnant. Don't begin to waste your time, you and your woman, without knowledge. So you see, family planning is all about the knowledge you acquire that will help you to build a better family. Now, number 4 aspect, diagnosis and management of infertility. There are several reasons why a woman may marry or they are in a relationship, the couple may not have pregnancy. In the hospital, we will help them to trace the causes of infertility, treat it, and show them how to have babies. But in our community, people instead believe that when you are going to family planning, it is to stop giving birth. No, it's a misconception. Instead, family planning will teach you how to make a family. Like I said, there must be father, mother, and children. So we'll teach you how to have these children. And if there's any reason why the baby is not coming, we will trace it. There might be an infection in the womb. There may be blockage in the fallopian tube. The ovaries might not be ovulating. The man too, the testes might not be producing sperm. There could also be a blockage in the man, like in the vas deferens, the epididymis. Like the problem could be in the woman as well as it could be in the man. So we need the two of them to go for consultation. We trace the cause of infertility, treat it, show them how to have babies. They will have a happy family, and we are good to go. That they came, we gave them knowledge, and now they have a happy family. Now, one of the components is sex determination. People don't know that you can come to the family planning unit in any hospital and you are taught on how to determine the sex of your child. It is possible to have a boy child. You and your wife sit down and plan and know how to target sexual intercourse, that could give you up to about 90% chances of having the sex that you wish. If it's a boy child, we can teach you to have up to 90% chances of having that which you want. If it's a boy child that you need, we can teach you to have up to 90% chances of having what you want, even though it's not a 100% kind of thing, but acquire the knowledge and leave the rest to God. You will be happy and your family will be happy. Do you know that when people have this knowledge, a man will never blame a woman? Some men blame women for having only girls. It's a wrong thing because the woman doesn't determine sex of a child. What is in the ovary of the woman in relation to reproduction, as far as sex of baby is concerned, is woman. That's all. XX as the sex chromosome in the woman. But when you go to the man, the sex chromosomes include XY. And when a man, the sperm cell and the egg have to meet, you only contribute one of them. You have XY as a man. The woman has XX. If you give X, they will pick any of the X in the lady and it will still produce only woman. But if you want a boy, give Y to the woman. It will pick one of the X there and combine and it is XY. Anytime you see XY, it's a male. Each time you see XX, it's a female. If men have this knowledge, they will apologize to their wives. A lot of men have even gone to marry even second wife because the wife is having one sex. No, it's an abuse on the woman, which must stop. The man, it should be the woman, it should be the woman to drive you away. It should be the woman to tell the man that if I give birth to a girl in this house again, you will leave this house. So that the man should go and learn. We can encourage women to beg their husbands to come to hospital. Let us teach the man to know that what you put in a woman is what she will prepare and give you. Did you put the male before he did not give you? Please, men, sit up. Come and acquire knowledge of family planning. If you don't know that this is family planning. Because most of the time, only women struggle to go to hospital for family planning. And the men now think that they are trying to limit the number of children. That is why I have talked to a few people and a man, young man, who just got married. The wife is having a second baby. And I advised them on talking about family planning. And the guy asked me, doctor, we just married. My wife has only 2 children. How can I be talking family planning now? Before I took my time to explain that, they are even starting to hear the information about family planning late. These 2 children that you had, you would have planned better to have them. Family planning knowledge doesn't stop a woman from having children. It doesn't even limit your children. You will limit them yourself with your knowledge, with your means. Because when you have the knowledge, you will wish your children to be presidents, to be engineers, to be this. Do you know what it takes to do that? Do you have the money? If you have money that can bring up one, you will be the one to tell me that I cannot have the second. I want this one to be president. And you concentrate your resources on the person. But you see somebody has enough resources and he wants to have 10 children. Will he come and compare with me? No. So you will decide and not me. It is not the hospital that cares somebody to have only 2. It is not the hospital that tells somebody to have only 3. Now, I leave that component there. And another component of family planning is screening for sexually transmissible infections. For example, HIV, hepatitis B, and even human papillomavirus. But this human papillomavirus particularly is coming under another component we call screening for cervical cancer. Because this virus, human papillomavirus, is responsible for causing cervical cancer in the woman. And so hardly will you sit in the family planning unit and a woman will come to request to screen for cervical cancer. But that is the family planning service. A majority of those you see them moving to hospital are going now for the last component that I want to give now, which we call contraceptive devices, contraceptive methods, contraceptive technology. A lot of people think that family planning is all about contraceptives. But contraceptive, meaning measures to prevent pregnancy, which could be natural as well as could be modern or artificial methods. A lot believe that when you are going for family planning, you are going to take an injection so that it will prevent you from pregnancy. They believe that when you are going there, you are going to take some tablets, some pills to prevent pregnancy, or some implants, or some coil, or to take condom, or to take any of the contraceptive methods. This, for your information, comes last in family planning. When you have acquired the knowledge, you will look for the baby. When you will have the child, you will be the one to ask questions that what do I do to stay safe so that this child can be at least 2 years, 3 years, 4 years, or so that this my child can even be going to school before I can have another one. You will be the one to come to us and ask that doctor, I fit do how? What can I do? My baby is young. My husband is hot. She wishes to be having sex all now. And then I'll introduce to you methods to prevent pregnancy. You are preventing at that time because you choose to space your child. It is not me imposing on you. So it is good for everybody to acquire the knowledge. Use it where necessary.
Thank you very much, Dr. Ayem. It is good for everyone to. It is good that everyone acquires this knowledge so that we can better have the kind of family that we wish for. Well, ladies and gentlemen, it is here that we come to the end of this program. I want to thank Dr. Ayem for coming, and we hope that whenever we place a call, he will answer present. In case you have any question, any worry about family planning, make good use of the comment section below. Drop your comments, drop your questions, and trust me, Dr. Ayem is going to make sure that you get your answers. Don't also forget to like and share this video, and don't also forget to subscribe. When you subscribe, you'll be getting more of such videos that will actually educate you on matters concerning family planning. It is here that we end the program. I am Dingana Raymond. Stay tuned.